So here's something interesting. The state of Oregon has recriminalized drugs. Oregon governor signs bill reintroducing criminal penalties for drug possession. Tina Kotek signed bill into law that recriminalizes the possession of small amounts of drugs. It was the first in the nation to decriminalize small amounts of drugs. That was enacted 3 years ago, 2021. And it was intended to eliminate criminal penalties for possession of small amounts of illicit drugs. But this will now be repealed under the new law. Instead, a person with small amounts of illicit drugs will face a new drug enforcement misdemeanor. Now, you might be asking yourself, why would states decriminalize small amounts of possession of drugs? Now, there's a lot of research on this, but I guess at a high level, one, it's not taking a criminal approach or a law enforcement approach to a public health issue. So for some people, they say, you used hard drugs because something happened in your life, right? You lost someone close to you, a job, a family member, etc. Or something very traumatic happened, which compelled you to use hard drugs like cocaine, methamphetamine, fentanyl, morphine, etc. And the impact these drugs have is it rewires your brain. And because it rewires your brain and changes your chemistry in your body, your drug addiction it's no longer a choice. The drugs now kind of have a little bit of control over you. And then the longer you do it, it has more and more control over you. So again, the idea being that drugs are are part of something traumatic that you've been through in your life. So decriminalizing drugs allows states, again, it's not my argument, but it allows states to look at drugs from a public health approach. Maybe we provide this person with programs and services and safe needle exchanges and a whole host of other public interventions that can maybe allow them to make better choices instead of slapping them with a criminal sentence, putting them in jail for a short period of time if they're a first-time offender. That approach is a waste of our resources. We spend a lot of money sending people to jail. This is a much better approach, and hopefully these small nudges like needle exchange, etc., handing out pamphlets about drug rehab, etc., maybe spurs someone along to drop drugs completely and get clean. Now, the flip side to this is multiple, but I'll get into that in a second. Before I get there, though, I just wanted to share with you what others have actually said about drug decriminalization. So I'm going to share with you what the American Pharmacists Association, in their policies adopted by the 2023 House of Delegates, if you scroll right to the bottom, my apologies for the fastness of this, the American Pharmacists Association supports decriminalization of the personal possession or personal use of illicit drug substances or paraphernalia. Very interesting. Again, as I mentioned, APHA supports the voluntary pathways for the treatment and rehabilitation of individuals who have been charged with possession or use of illicit drug substances and who have substance use or other related medical disorders. So, very interesting here that the APHA themselves say that there's the ability for treatment and rehabilitation services. Now, of course, APHA says that they support criminal penalties for persons convicted of drug trafficking and manufacturing whenever alternative pathways are inappropriate as determined by the court. So, very interesting that you'll see a lot of academics and organizations say they support drug decriminalization for the individual, but if they are selling drugs, if they are part of a larger network, they no longer support drug decriminalization for that person because they're trying to, I guess the idea is, you're now promoting drugs in our communities, and that's not a healthy thing. Now, you might be saying that after decriminalization happened in 2021, we would see some marked decrease in opioid deaths in Oregon. My apologies. Canadian over here. So let's take a look. Oregon Public Health Division, opioid overdose public health surveillance update, January 2024. This is interesting. So 2021, the decriminalization goes into effect. Opioid overdose deaths total 738. In 2022, they total 956. And in 2023, they total currently, based on the data, 628. So, I mean, listen, I'm not saying that as soon as the policy goes into place, there should be a marked decrease in overdose deaths, but one would surmise with small amounts of possession being decriminalized, there would be some level of impact, although one could argue we haven't seen it for a sustained period of time. But basically what we've seen since 2021 is unintentional opioid overdose deaths have actually gone up. In 2022 and 2023, it went down quite a bit. But still, from 2021 to 2023, very much higher than the numbers in 2019 at 280. Of course, in my opinion, I think COVID-19 had a lot to do with that, probably still does. There's research from many jurisdictions about the impacts of COVID on drug use. So, interestingly enough, when we look at states that have decriminalized drugs, we know that there's not that much evidence to support some of the findings, some of the ideas that policy professionals have had. The idea that decriminalizing drugs will potentially lead to lower deaths and potential better life chances for the individual. The research just isn't there to support that. And I think this is also an indication of sometimes when in policy where policymakers get so wrapped up with the shiny new object. And in this case, the shiny new object is decriminalization. If we decriminalize really hard drugs, somehow people will make better life choices. And it will showcase why criminalization was always a bad idea. In a way, it kind of reminds me of the electric vehicle debate right now. Forget trying to make gasoline cars more efficient. Let's just jump onto electric vehicles, regardless of the risks associated with wide-scale adoption of electric vehicles. You need chargers, you need batteries, etc. So very similar here. I don't think there's enough evidence long-term to show that decriminalization of small amounts of drugs leads drug users to better life choices. And some might argue, well, the design is wrong. The small amount of possession isn't big enough. 2.5 grams, like in BC, which is currently going through a 3-year pilot of decriminalizing hard drugs. Some would say, well, it's only 2.5 grams. That's not a lot of drugs. But again, let's think about, is this actually leading to better life choices for the individual? The last thing I'll say about this is one thing policy professionals are also missing is the impact this may have to the community. And I'm not talking about the community where drug use is happening. I'm talking about the community writ large, the message it may be sending to members of our community who do not agree at all with drug decriminalization. This furthers the gulf between, policy professionals saying this is a progressive approach towards those who have real serious concerns with drug decriminalization. That gulf between, people grow more when governments are starting to pursue what I would consider pretty far-reaching policy that's not tested. And as a result, I think that there's real implications for politicians. There's also real implications for the general public when we see policy professionals really going pretty far on these ideas. So all that said, very interesting to see that Oregon is recriminalizing drugs. And I'd be interested to see how the 3-year pilot in British Columbia here in Canada is going, which currently decriminalizes really hard drugs, 2.5 grams, and the outcomes specific to the individuals that are using it.